Good morning, everyone. I'm MP Abubakar Babisho. This is the third episode as we scheduled or planned to be having a presentations on mental health and mental illness on monthly basis. So, we receive a lot of feedbacks and responses. So, we adopted some strategies, some aspects of parts as part of the presentation will be in English and the other parts will be in Hausa. So this one is a third one in the series. So now today I I wanted to talk about one condition we called obsessive compulsive disorder. We called it OCD. So this is the uh, types of disorder that occur cases of mental illness is the fourth in the range of mental illness. We have phobia, we have substance abuse, we have major depression. Then the OCD, obsessive compulsive disorder, is the fourth one in the series. So, looking at what obsession is talking about, obsession is the thoughts, repetitive thoughts, you know, repetitive images that we may be having, hearing, thoughts and acts is the obsessions. While when we talk about when we talk about compulsion, compulsion is the repetitive behaviors, repetitive acts, repetitive actions by an individual. While uh, obsessions is intrusive, repetitive, recurrent, and persistent thoughts. So, one an individual that is suffering from this kind of condition try to what at times they try to see that uh, they move away from the anxiety by performing some kind of behavior just to prevent themselves or to relieve from particular uh, anxious situations. So it is very common. The obsessive compulsive disorder is very common. It occurs. It is about 2 to 3% in general populations. So, within the general population, 2 to 3% of an individuals are suffering from this obsessive compulsive disorder, while 10% of the patients that attended psychiatric clinic, 10% of them, they are suffering from this obsessive compulsive disorder. This condition is is alarming. It occurs. So so at times it happens and in the community people doesn't consider it to be a problem until or unless it becomes aggravated or when the situation is worst. That is when people start taking measures, maybe going to babalawos, going to bokas and other things be- before they came back to the facility and looking for the assistance. At that particular period, you can say it's late. So that is OCD. So there are a lot of causes that cause these conditions. We have biological causes, which is biological makeup of an individual. In the body of an individual, we have what called neurotransmitters. Neurotransmitters, they are biological, substances that chemicals, I can say, receptors that are within the body of an individual. Their aims is just to transmit information from one point to another, carry information from one point to another. So that is how uh, God created them within the body of an individual. So based on studies, these biological factors, like one of the neurotransmitters, serotonin, so we say is involved in the conditions of this particular disorder. Then, apart from this, we have behavioral factors. Some of the behavior of an individual, people that are perfectionist, people that are perfectionism, people that are doing things in details. Some of the behaviors can predispose one to have this particular condition, OCD. So that is, so how can you identify one with these conditions? You can identify individual with these particular conditions by performing, some kinds of behaviors or actions persistently, doing it again. Like maybe when you go, maybe in the night when you close the door, he will, one will wake up and look at whether he locked the door or not. Then he came back and lie down also. Then after some minutes, he will also go back to recheck to see that whether he closed the door or not. So that is one of the examples that you can identify. Then another one, you may have one be having thinking, bad thinking, maybe sexual thinking related to sexuality. Maybe he may be thinking of having some kinds of sexual relationship with one. He be having that particular thoughts. So, or cleaning hand, frequent cleanliness of the hands. Sometimes in women, they suffer from that because there are kinds of women that they always sweep their house. Whenever they go to any house, either neighbors or family, some family house for a visit, now they will start, you know, sweeping the house. So this is some kinds of manifestation that you will see from a particular individual. So when you start seeing this, so there are a lot of, we expect you to take measures. Part of the measure that you'll be taking, maybe you linked after that particular individual to a facility or to a resource where he will get help, maybe to mental health professionals, family doctor, to a facility. So you can link up that particular individual so that you will be having early treatment. Then that's for the compulsion, but it persists for a long period of times. Actually, it becomes complicated. So there are a lot of measures we are taking in the treatment of this. We have use of drugs, psychotherapy, psychopharmacotherapy. We used drugs in the treatment of this disorder. Then we have behavior therapy. That is one we are encouraging without the use of drugs. Behavior modifications, either using aversion or desensitization methods or inclusion behavior methods. We do that. Then we have, apart from behavioral therapy, we have group therapy or family therapy. We use them. We encourage them more. So that is, thank you very much. Then let me just explain it quickly in Hausa. Abin da yake magana a kai shine akwai wata cuta wanda gaskiya tana nan yanzu, matsala ce ta ƙwaƙwalwa wanda mutane suke fama da ita, amma kuma gaskiya kusan ba a yi noticing ɗinta a matsayin matsala ba, amma tana nan kuma ana ta fama da ita. Wannan matsalar shine zai sa mutum, akwai wanda za ka ga yana ta yawan tunani akai-akai. Ai za mummuna, ko yake zai ta tunani akai-akai, wannan tunanin ya ƙi barin zuciyarsa, ko kuma ya dinga saka masa abin da ake cewa kokwanto a cikin zuciya, da razanarwa da tsoratarwa a tattare da shi, alhali kuma babu wannan abin a ƙasa. So yawanci mutane da suke da irin wannan abubuwan sukan nemi hanyar da za su ɗan samu sauƙi tattare da gare su, shine ba su dinga yin wani abu wanda zai ɗan ɗauke musu kewa. Shine da aka ce daga cikin abubuwan da suke yi yawanci shine za ka ga ko mutumin da sai ya abu, mutum mai taka tsantsan, wanda zai yi abu ya sake tabbatar cewa ya yi shi daidai. Idan ba haka ba, yana ganin idan ba shi ba wanda ya yi shi daidai, sai ya sake. Ko kuma mutanen da za ka ga yana yawan wanke hannu, ko kuma tsafta ta yawa akai-akai, ko kuma mutum ya kwanta ya tunanin bai rufe ƙofa ba, ya zo ya rufe, ya ƙara zuwa zo ya buɗe ya rufe. To shine muke cewa duk in ka ga irin wannan abubuwan ya fara faruwa da mutum ko kuma da kanka, so za ka iya ƙoƙari ka nemi hanyar da za a iya samun taimakon gaggawa ai za ko zuwa asibiti ko kuma wani wanda ka sani wanda ya karatu na lafiya za ka iya masa magana ga damuwar da kake ciki zai iya kawo maka hanya a kai, ko kuma idan ka san wani wanda yake da hidima da ƙwaƙwalwa shi ma za ka iya masa magana. So irin waɗannan abubuwan su ne wanda za su iya sa mu taimaka wa al'ummarmu ya zamana cewa mun samu ɗan sauƙi a cikin wannan abun tunda Ubangiji ya ba da ilimi a kai. So assalamu alaikum wa rahmatullahi wa barakatuhu.